You can hear
Hi,
me
everybody.
okay?
AJ Heitman here with the GEMS EMS Today show. Kind of a lighthearted, fun, informative show that we have on GEMS right now. And I'm pleased to have with me today Steve Wirth, one of the founding partners of Page, Wolfberg, and Wirth. Steve, welcome.
Great. Good to be here, AJ.
And you know,
Remotely.
this is amazing for me because it was 20 years ago. This is the anniversary of PWW, and it was started in conjunction with Jim Page. And
That's right.
I think back then you had 2 employees, and you're up to what, 17 now?
About 17. That's right. Yeah, it's been a gratifying 20 years. And we all started, the genesis of Page, Wolfberg, and Wirth as a law firm really started at the EMS Insider Conference in Mount Airy, Pennsylvania, near Scranton, your old stomping grounds, AJ.
Yeah.
And I think they've torn down that old hotel now. But back in the summer of 1999, we were there for the EMS Insider Conference, myself and Doug and Jim. I think you were there too, if I'm not mistaken.
Well, I think that's when we called it Mount Scary, because it was.
We called it Mount Scary because it was like
down.
It was like the hotel out of The Shining, you know.
I get it.
It was a big place. But anyway, that's where we sort of started talking about the concept of starting a law firm that focused on EMS, because really there was no law firm out there that did what we do today. So we got together with Jim Page a couple months later and called him up and said, hey, Jim, would you be interested in going into this venture with us? Myself and Doug Wolfberg called Jim up on the phone, and he said, sure, yeah, that'd be great. He asked us, one thing he did ask us, he says, do you think there's going to be enough business in this field?
Boy, how about it?
And we said, absolutely there will be, because Doug and I were getting lots of calls. You know, he and I worked at 2 separate competing large law firms, and we got a lot of calls. So it's interesting. It's very gratifying to see that we sort of created the whole healthcare law subspecialty of EMS law. You know, so it's been very gratifying, and, you know, serving all sorts of EMS clients from around the country. We like to say we represent agencies in all 50 states and U.S. territories as well. And
unarguably the leader in EMS law, and one of the best conferences now annually, and you're going to have to do like many others now and hold off on your one conference and hold it virtually, but I'm sure you'll do that very well.
That's right. Yeah, we had 3 conferences planned in the spring in Vegas, St. Louis, and in Clearwater Beach, Florida. So yeah, we're looking at doing these virtually, and we're working on that now. We're diligently taping. As you can see, we got formal backgrounds back there, you know, to make it look good. We wear our uniform shirts.
But what the audience didn't see is I have my background of my 2 prized possessions, Charlie and Cooper. But right before we started filming, one of the love of your lives, Piper, was on, and that's
our golden retriever Piper.
Retriever, English variety, and what a beautiful dog. So we follow each other's puppies, and that's
we do. You have 2 great dogs.
This backdrop up here, but I'm hunkered in here. I have I'm overweight. I've had a history of a little CVA problem and a couple of other things that this black devil is out looking for. So I'm trying to hide from the coronavirus. And our focus today is to talk about the coronavirus because, you know, as we were talking about, many people may not realize it within their organizations, but in the round 1 of the CARES funding, they got some money. Really? Didn't they get about $60,000 on $1 million worth of Medicare?
Oh my goodness, it's unprecedented, AJ. I mean, for years, you know, the ambulance industry and EMS was fighting with Congress to get a few $1 million, and then they dropped millions of dollars into the coffers of healthcare organizations. And it was really needed because, as you know, ambulance companies, EMS agencies across this country have been suffering from, you know, low call volumes. In some cases, they've had to lay people off. So they've seen a huge decline in revenue. So the CARES Act Provider Relief Fund gave a bolus of money to all healthcare providers, everybody who billed Medicare. They based it on your last year's Medicare dollars that you received from Medicare fee-for-service, the traditional Medicare program. And essentially, if you received $1 million from Medicare last year, you got $62,000 deposited into your bank account. That's the average. That would be what the calculation came out to. So I've talked to ambulance companies, and rural Nebraska and the West and Midwest that are running like 150 calls a year. I talked to a lady just the other day. She said, we got $1,000 and it's nice to have. I've talked to other ambulance companies who got well over $1 million. And that was round one. Round two, and as you saw, President Trump, signed into the law the second, I think it was about the third set of legislative efforts to help deal with this coronavirus. So that round two now is an application process. If you got money from round one, which just about everybody did because it was automatically deposited in your account, then you just apply on the portal, and then you have to provide some additional information like a tax return, a 990 tax return kind of thing, some additional information. It's not complicated. We've talked to clients. It takes about 10 to 15 minutes to complete the application online. And then they'll expect to see another bolus of money. And they are asking for some financial information. They ask you on this round to estimate what your estimated revenue losses were for March and April of this year. And there's a wide range, bunch of different ways to calculate that, as long as it's in good faith and it's based on fact and it's reasonable. That should be sufficient. So it's a relatively easy process. There are a few terms and conditions for receiving these monies. The main one is you have to promise not to balance bill COVID-19 patients. Okay, you have to accept the insurance that what insurance would pay for COVID-19 patients, and you just have to you promise that you needed the money based on losses that you've had, and that you're going to spend the money on COVID-related expenses, preparing for and dealing with the COVID-19 crisis.
Now, there was an interpretation that almost any patient that we would see in this day and age could be a COVID patient. So does that mean we can't balance bill any patient, or has clarification come out on that?
Well, I'm glad you asked that. Yeah, HHS talked about, they said in terms of eligibility for the funds, they wanted to make sure that all healthcare organizations would be eligible. And they said, look, we consider, basically every healthcare organization is going to deal with COVID-19 patients. So, even if you don't deal with too many of them, we'll consider you as eligible. So that's the context that they said we consider, all patients a potential COVID-19 patient. That was for the eligibility side. Really. So no, the balanced billing provision only applies to COVID-19 patients or suspected COVID-19 patients as well. And, you base it on CDC guidelines and things like that. So it's not every patient. Although,
so if you had a respiratory distress patient,
yeah,
that's a sticky wicket, because you could say, well, that could have been COVID. Am I right?
Yeah. AJ, they're making it up. They're making it up as they go along. This is unprecedented. The government, have you ever seen a situation in your lifetime where the government deposited money into your bank account without telling you and then told you they did it? That's what they did here.
Never.
So they're making up the rules as they go along because there's no time. Congress acted quickly, really, in the scheme of things, despite all the debate about people not getting along. Congress did get along and really did a lot of good things to help here in terms of, helping healthcare organizations. Is it enough? Of course not. It's not going to be nearly enough, but it's a big help.
And there was another nasty rumor floating around the web that because HHS felt that almost any patient these days could be potentially asymptomatic or symptomatic COVID, that you couldn't balance bill anybody, and that would be devastating on the ALS billables, right?
Yeah, well, I'll be candid with you. The insurance industry is trying every which way they can to backdoor a prohibition across the country to prevent balance billing, and that's part of where that's coming from. But no, to receive the CARES Act funds, that prohibition only applies to COVID patients. So we'll clear that one up right here.
Okay, so if my service got some funding and they want additional funding, what do they have to do? They have to apply online, and then they have
they have to go to the portal, the CARES Act portal. It's easy to find. HHS CARES Act,
right.
relief fund. Just Google it. It's there. And there's a simple portal to go on to apply. You need some information like your tax ID number and so forth, and you have to be prepared to upload a tax return. Now, one problem they've had with this second round is they didn't think about government EMS agencies, government operated municipal entities.
Right.
And so they're telling them they have to provide financial information, but they're not requiring a tax return now because they
Right.
don't file tax returns. So, yeah. So, but it's an example of every step along the way. Things in this national health emergency are changing day to day, hour to hour, almost minute by minute. And hey, the folks at HHS and in the government, they're human beings like the rest of us. And they're working hard and fast, and it's hard for them to keep up and getting all the rules out and to get it. And they make mistakes along the way. That was a mistake.
Oh, you represent all different size agencies and types of agencies.
Oh yeah, all
Has
different
the private
sizes,
industry-
types, you
has
name
the
it.
private industry not getting their fair share?
No, I think everybody's getting their share. You could argue over, some getting more than others, but there's a lot of different programs. There's a lot of public sector programs. There's a lot of programs for the private sector. So through the Small Business Administration, which
Right.
is the CARES Act, or excuse me, which is the Paycheck Protection Program, which is another great program too to help small businesses, which are, most ambulance companies in this country are small businesses. So yeah, so there's a lot of programs. Do we need more? Absolutely. We got to lobby Congress to give more money. Unfortunately, it took a national crisis like this for everybody to say in Congress, we need to put more money into our healthcare system and in our pre-hospital healthcare system.
So what are you hearing from your clients? Some of them have been devastated because they've had to lay off some of their
Right.
transport crews, which is devastating for those folks.
Yes.
Some question whether they're going to even recover that and bring that back in after this is over. I don't think anybody has a crystal ball to see what's going to happen.
No, we don't. But it's tough for everybody. We really emphasize with the frontline crews, as you know, AJ. We're both old school paramedics. It's tough out there, and we've never seen a crisis like this where we're dealing with a disease that no one really knows what the course of that disease is going to be, and we're starting to get a handle on it. So our folks on the front line, God bless them, they're out there risking their lives and working many, many shifts and dealing with everything from PPE shortages to, the situation where they're dealing with family members who cannot accompany their loved one to the hospital, which the CDC recommends, not they can't go along, and the situation there is people are in bad shape, their loved ones can't be with them. You've got that problem. You got the stresses associated with that, and people need to look out for themselves and look out for each other, and we're good about looking out for each other in EMS, but we got to keep asking each other, how you doing? Are you okay? You feeling all right? That type of thing. And the organizations are struggling. Even though there's these funding streams that are helping, when you talk about ambulance companies around this country and EMS agencies losing 20 to 80% of their call volume, that's huge. Their personnel staffing, their budgets, all based on the revenue that comes in from those calls. And everybody I've talked to has seen a loss. The only exception would be a minuscule number of ambulance companies in this country that do like inter-facility transports contracted with a hospital because they're moving patients around at different locations. That's it, but that's a small minuscule. Even 911 services have seen a big decrease as well. Not as big as the non-emergency ambulance service decrease, but nobody's having accidents because they're all staying at home.
Yeah, and the unseen cost is the cost of losing some of your people to not just getting sick, but staying away and being sequestered for maybe 14
That's right.
days.
You have the problems with quarantine, and you have the problems with just the effect that this has on people's longevity in EMS. We know that the average tenure of an EMS practitioner is about 3 to 4 years. We know that from recent studies. The concern now is, are we going to be able to recruit people and keep good people? But again, that's why we got to admire those folks out there every single day on the street doing a great job every single day.
God, I love them. I used to get in trouble when I'd be in the fire service, as you know, and I'd come home and Betsy would make me take my bunkers off outside and scrub them and clean them. But imagining, there was an article in our paper yesterday about donning and doffing and, putting booties on to come home in your car and then taking.
Oh, how uncomfortable! How uncomfortable!
Well, and concern. Just the emotional toll that it takes on people to think that maybe they're bringing some of that unseen death into their home. It's awful.
That's right. Yeah, there's so many stresses associated with this. It's affecting everybody, and everybody's stressed out at all levels, and I think we just got to be grateful for what we have today and to do the best job we can and be kind to other people, just remember those kinds of things and not to take things personally because everybody's nerves are on edge, Now here I'm giving Mike Tagman's speech, but all of those things you need to do and to help deal with the stresses. So lots going on.
What kind of issues, what kind of things have you been telling your clients and others as we go into this? There's certainly HIPAA concerns. Have you been talking to your clients about HIPAA?
Oh, sure. Yeah. Well, HIPAA's always been a concern because particularly when it came to sharing information from the hospitals to the EMS agencies. Hospitals have always been very reluctant to share information. Now, HIPAA always allowed them to share that information, share patient information with the ambulance service because they're all engaged in treatment of the patient. Okay, so you're allowed to do that. But hospitals have often hid behind HIPAA in not sharing information. And also, in the initial stages of the pandemic a few weeks ago, isn't it amazing that's only been like 6 weeks ago that this all started, 5-6 weeks ago. Hospitals weren't even sharing with ambulance services if they brought in a patient. They weren't even letting them know if the patient was COVID-19 positive, which is simply wrong. They're allowed to share that under HIPAA. They were allowed to do that all along. Plus, under the Ryan White law, as you know, which sort of fell by the wayside in recent years, but came about, back, 20 some years ago, or 30 years ago with the AIDS epidemic. Hospitals are required, with these kinds of droplet carrying the diseases carried by droplet infection, they're required to tell the ambulance company's infection control officer that there was a patient who was positive, so that proper assessment and notifications.
And that's a real solid bullet point. We had Kathy West down, and she talked about the Ryan White and the fact that you let the hospitals know that under Ryan White that they are required. In fact,
that's right. Another aspect of HIPAA.
For days and not know.
Yeah. Another aspect of HIPAA. There's a provision in HIPAA that doesn't get used that often, but it is now. It's a very valid provision, and that is you're allowed to share protected health information about a patient with someone who has a reasonable, they're in a position where they could reasonably influence preventing an imminent threat to other people. So in other words, you can share patient information about a COVID-19 patient with those who could prevent infection. You can share that information with EMS to prevent exposures from continuing. So if there is a potential for imminent threat to the health or safety of others, you're allowed to share information as well. So that's a provision under HIPAA that hasn't been exercised very much, but it is certainly one.
Who could EMS share that information with? The police officers that were on scene?
Yes, they can. It's more open, and you could share information with the communications center. The communications center can share information. Now you got to use some common sense. You're not going to blurt out names and things like that, and unnecessarily. But yes, there's much more, much greater ability now to share information with others who could potentially get infected. Is really what it comes down to.
And what about patient signatures? Anything change with patient signatures?
Patient signatures, yeah, there's been some relaxing of the rules, which is good. One of the requirements to submit a claim to Medicare is you have to get a patient signature. an assignment of benefit signature, they call it. What CMS has done is they've relaxed that a bit and said, look, okay, if it is a situation where you have a COVID-19 patient and you're gowned up, you got PPE on, look, it doesn't make any sense to give that patient a pen and have them, or a stylus and the fill, to sign their tough book. Okay, makes no sense. In fact, the CDC recommends that EMS documentation be done after the call, after they remove their PPE, and after they do the happy birthday thing and wash their hands. So there's been some relaxing there. So what CMS has said, Center for Medicare and Medicaid Services has said, is that if you just get verbal consent from the patient and document that verbal consent, and that would be sufficient as a patient signature. Okay, so that helps too. That's a helpful point.
And isn't it a sin that we have to have a pandemic for things that we probably should have had CMS's sympathy for and ear for decades?
Yeah,
it's amazing to me.
It is, and I think, as you mentioned, it takes a pandemic, but one of the things we're going to see change. I mean, look what's happened with telemedicine, telehealth, okay? I was listening to a story last night of a hospital that had at most 20 telehealth visits 2 months ago. Right. Today, they've got like 20,000 in the same month, same period. We're going to see a revolution there. And, we know that Medicare was about to test the ET3 program, the treat in place, and to provide reimbursement under Medicare to ambulance companies who treat in place with telemedicine with a healthcare practitioner, as well as payment for transport to alternative destinations. Well, guess what? That just turned into a volcano. I mean, it's huge now. That's what we're doing, and I think it's going to accelerate, the ability eventually here, after this settles down, of EMS agencies to be able to bill for these kinds of services, which are so essential, as we found out in this national health emergency. Where would we be without telemedicine today in this crisis?
No. So if you were a service that just now went into telemedicine, you could treat and release right now. Is that right?
Well, treat and release, we could always do that. But you got to follow your local protocols, because what's happened now is with the pandemic, this is based on the practice within the region or within that agency, in what the medical director decides to do there. Yeah, we're seeing more treat and release now in accordance with protocols, and we're seeing transport to alternative destinations now as well. We're not seeing a lot of telemedicine on the ambulance services yet, although we're seeing more today. But I think we're going to see that evolve, in the coming months significantly.
Well, and I don't think, and you probably don't either, that we're ever going to go back to the way it was. We've opened up the door now, and services better start thinking about an after action to what's life going to be like 6 months to a year from now.
Right. There's going to be certainly a lot of changes, a lot of preparation for a pandemic. We're going to be better prepared. Like Bill Gates said on his TED Talk a few years ago, this is an area that we weren't prepared for, by and large as a nation.
Well, I've heard today the Navy ship is going to be leaving New York, and everybody thought that the hospitals would just be so thrilled to release patients to go over to the Navy ship, but that didn't really happen because, you free that up and you can't bill for that bed space. So that really didn't happen. And, the hospitals are hurting. Hospitals are hurting because they haven't had elective surgery either.
That's right. We shut down elective surgeries. People are afraid to go to hospitals. Yeah. And another thing I know you've been following is the increase in strokes and cardiac arrests we're seeing now. What I've heard from, all of our clients, they say we've seen a great drop in the number of transports, but the acuity level has gone way up. The acuity has gone up. People are delaying calling EMS, and they shouldn't. I know Dr. Brent Myers and folks at ESO were looking at that with their statistics, and It's really kind of scary when you think of all the impact that the coronavirus has had on the healthcare system, from empty hospitals and laid off healthcare workers to people having strokes and heart attacks in the field and dying because they're afraid to go to the hospital. I mean, amazing.
Well, and there was just a big article in the news today about New York that said that a couple of doctors pointed out that younger adults are suffering strokes from
Yeah.
large vein occlusions that they never would have had before, but the virus is causing that quick coagulation.
That's fascinating. Yeah, I saw that report as well. Yeah, there's so much going on, as they say, in our healthcare system today, and there will be a lot of changes in the future. I think we're going to see a better capacity for the future in terms of reserve capacity and surge capacity. As we all know, that was a serious problem here. Unfortunately, our healthcare system that's gone through so many consolidations, and we have big business in healthcare these days, and equity investors and all that. Empty hospital beds don't generate revenue. Well, we may need, and ventilators that don't get used don't generate revenue. But we got to rethink our healthcare model.
Well, I'll hit you with two concerns that I've had from multiple people. One is PPE issues.
Yes.
What if my agency doesn't give me a gown, or they don't have N95s? Of course, we're still in a system where we don't have a lead EMS agency, and we have to go up the food chain through emergency management to get PPE. But the reality is that should be taken care of, hopefully.
That's right.
As well.
And the tough part is, I talk with paramedics on the street. I have a good friend of mine. He's probably a good friend of yours as well, from Massachusetts, who's a frontline medic for many years, and a very well-read individual who is just telling me, giving me reports of what it's like. And, he works at a place where they don't have adequate PPE. They're reusing PPE. They can't get proper equipment. They don't, always sanitize their vehicles the way they should. So, it's a tough situation for a frontline caregiver, because you don't have a whole lot of recourse, okay? Because in our working world, your option is you can, continue to work or leave, it really comes down to that in many cases. But what employers need to understand, I think, from the standpoint of PPE, and they're struggling too. On the employer side, they're having trouble getting this stuff. They need to talk to their employees and let them know what they're doing to help. And
so
they
do
need
they have
to,
any, this is a sticky one, do they have any liability here? I mean, if the guy documents on his trip sheet that he wasn't given proper PPE and then he dies from COVID, or
well, I mean,
come back after them?
Well, I think the court system will see the story down the road on that one. But yeah, I think there's some potential liability, certainly, for if you don't provide your employees with the adequate safeguards and safety equipment. And what I was going to point out is what employers also have to understand: OSHA has anti-retaliation provisions in it, so that if employees do come to you with complaints about inadequate safety equipment or PPE, you can't fire them. You can't, retaliate against them. The National Labor Relations Act also has a provision in it under Section 7 that protects employees who work together for mutual aid or protection and go to their employer with safety concerns. They cannot be retaliated against or terminated because of that. So there are protections for employees. But the bottom line is, this is mostly a workers' comp issue, AJ, and that's where the liability is mostly going to be limited to employers, because it's going to be a workers' comp incident. Now, where's that going to go? We're talking about a major change in our workers' comp system, because just like you've seen in Pennsylvania and a couple other states, where on the firefighting side, they've made cancer a presumption of that it was a work-acquired illness, okay, right, if you will, as a firefighter, that, okay? We see that happening nationwide in all the states are going to, I think already we're seeing multitude of states proposing bills now to make healthcare workers who contract COVID-19 the mere fact that they worked in healthcare with COVID-19 patients, and if they get it, it's going to be presumed that, they acquired it while working. Now, that's not the law yet, but I know Governor Inslee in Washington State, has made it a policy up there. They were the first state to really deal with this, where patient zero was located. But we're going to see this in the coming months, a lot of activity in the state legislatures to help protect healthcare workers, EMS professionals, if they contract COVID-19 while working. Mm-hmm.
Now, we also, I've heard from a bunch of friends who have been caught in the protocol conundrum where the protocols are changing almost every day. And one said that he went to intubate a patient and a supervisor was there and said, "We don't do that anymore." And he said, "What are you talking about?" He didn't argue in front of the family. He just bagged the patient, which he thought was even more dangerous. And then in the elevator, the supervisor said, "Well, that was my opinion." And so he documented it, which I think is the message, which I told him he did the right thing. He didn't go over the supervisor's orders, but he did document to be able to protect himself. So is that the right advice?
Yes, it is, AJ. It's spot on. In fact, this raises the point that everybody has to stay up to speed on the protocols and changes. Yes, there have been some changes in protocols, treatment protocols, dealing with oxygen administration, for example, and limiting the use of nebulized agents and things like that. So you got to keep up with this, but you can't write off a COVID-19 suspected patient just because it's your opinion, okay? So a supervisor that does that is acting outside of the realm they should be acting in.
And there's even been some controversy in New York State over termination of cardiac arrest. They had a clarification that, in some cases you weren't supposed to start CPR. In other cases, you were supposed to do it for 20 minutes. So people are confused.
Right, absolutely. And that's why you got to stay in touch with your state EMS agency and your medical director, who ultimately oversees the medical care provided by your EMS agency. So that's really, really important. And, it's just, if you just do what's right, as Jim Page used to say, always put yourself in the shoes of the patient. Always think about everything you do in terms of what impact it has on patient care, whether you're a frontline EMS practitioner, a dispatcher, an EMS lawyer, or a magazine publisher or editor.
And I think the last thing we want to talk about, because I know our friend Mike Taigman would hit us over the head if we didn't talk about it, and that's the stress factor. I mean, I read the article this morning about a young EMT in New York City from FDNY who committed suicide, obviously because of this and the stress of it all, and maybe not in his own personal life being prepared to cope with what's being thrown at him. And we're going to see more of this. So I think that the EMS managers, certainly if I was back as an EMS manager, as you were in our early days in Pennsylvania together, take care of your people, man. They're really going to need it.
Absolutely. Take care of yourself and take care of each other. And really that's what leadership has to do. And leadership has to be very visible at a time like this. That's another point. People want to hear from the leaders in the organization, and they want to be checked up on. They want to know, that that the leadership's in touch with what they're dealing with day in and day out on the front lines. So it's really important now more than ever for leadership in EMS to be out there, visible, management by being there, as they say, really, really critical. And that's how you're going to identify the problems. If you get out there as a CEO or a director or a chief or deputy chief, and you see firsthand how the crews are having problems dealing with the ER staff and getting information about a patient, or they're having trouble with getting PPE, or having difficulties with equipment and things. If you see it firsthand, you're going to appreciate it a lot better.
Yeah, and make sure you're training your crews on how to properly take off the equipment rather than just put it on, because that's how I'm hearing some people are getting exposed. they were never
That's right.
properly taught how to doff their equipment.
Incorrect doffing. Yeah, that's yeah. Everybody wants to rip it off, you know, not do it in a sequenced reverse step process, So
Yeah,
yeah,
I'm gonna post an article on GEMS that was a really in-depth article in our San Diego paper yesterday, that a nurse explained her whole process, and it's no different for a paramedic or an EMT
that's
about
right.
how she watches and puts the booties on and watches as a safety officer that the person next to her has their gown tied in the back. So,
That's right.
we have to do all of these things. Any final words, Steve? I mean, it's just an unprecedented time. I mean, you and I are old salts, and you just renewed your paramedic certification in Pennsylvania, as did I. And God, when you and I started, we didn't even wear gloves. The only pair of
That's
gloves
right.
we had in our unit was in the OB kit.
That's
So
right.
we didn't
You
start
got it.
IVs with gloves. I sound like that Saturday Night Live in my day,
Yeah,
but
that was pre-AIDS even.
we
Yeah.
didn't do that. We didn't wear goggles when we intubated people, and life is really going to be changed after this.
It is, and I think it's important to put it in perspective and just recognize the value of what everybody's doing in EMS, the value they are bringing to society. It's huge. I mean, where would people be in these communities without EMS? And I think that's important, to appreciate your folks and what they're doing, and to get the word out to your communities. Some other little changes in the laws that are not really well known is, for example, one of the changes is that it allows individual taxpayers now to donate up to $300 without having to itemize, an additional $300 deduction for donations. That's a big deal. As an EMS agency, as a nonprofit in particular, or a public agency, go out and talk to your community and say, hey, look, you're going to get some tax breaks. Corporations are getting tax breaks for additional donations. Get in there. The large nonprofits like the Red Cross, the Heart Association, all the big, nonprofits, they're sending letters out to everybody saying, hey, look at all these great tax benefits of donating to us. EMS agencies need to be doing that too. So I encourage everybody to get out in the community and ask for additional support, really. And my last thing, AJ, I don't know, those dogs are so well behaved. How can they stay still this entire time during this interview?
Well, I have two stakes that are hanging over the back of my head that you can't see. And if they really were, they'd be.
That's good. Those two, you've got them trained well.
Well, you know what? They're going through some stress too, because I take them to the Veterans Hospital and they're forbidden to go there now. So I have to take them out in the car and put their vests on so they feel like they're going somewhere.
That's right. That's a great thing that you do. Go and visit the veterans with the two dogs there. That's just wonderful.
But we're not allowed to do it, because if somebody is positive and touches the dog, and then somebody else the dog down the, so they're going through their own type of stress. So they get extra steak and treats. Believe me.
There you go.
They're as well treated as your dog is. You know that.
That's right.
Well, Steve, thanks a lot. There's been a couple of really good episodes. I'll plug the show that we're doing.
This is fun.
I talked to folks the other day from Sacramento. Within 1 week, they brought up 5 fire departments to do a community care program, and that interview is fascinating. And they've impacted over 300 nursing home patients by doing testing and swabbing, because, as you know, the nursing homes are a big hotbed. So there's a whole bunch of things. Dr. Clausen on Protocol 36, and just go shopping, because I don't want to have a bad interview, and that's why you're on here as well. So my best to you and to Doug Wolfberg on 20 very successful years, and best wishes for 20, 40, 60 more.
Well, thank you, AJ, and thank you for all your support at GEMS. And you've got your finger on the pulse, and you're doing great work there. So thanks a lot. And it's been great to be on the EMS Today show. That's pretty cool.
Well, thank you. And give Piper a hug for me.
Will do. Okay. Take care. Bye-bye.